Tracking irregular red blood cell shapes for human diseases with deep learning. Red blood cells, or RBCs, are responsible for oxygen and carbon dioxide transportation in our bodies, and it is well established that measurement of morphological abnormalities can be used for health evaluation and hematological disease diagnosis. There are approximately 3.6 to 5.4 million RBCs within a tiny drop of blood with 1 cubic millimeter volume. Therefore, we can obtain lots of image data for RBCs using only a small drop of blood. Utilizing the latest deep learning tools in image classification, we can precisely quantify the RBC morphological abnormalities and link to disease diagnosis and health status. A robust deep learning image classification method gives us a chance to efficiently and accurately measure irregular RBC shapes within a drop of blood and link to human health and diseases. The focus of this JClinic project is on diseases due to loss of spleen function. RBCs can be cleared from circulation by spleen when alterations in their size, shape, and deformability are detected. The function is modulated by the spleen-specific structure of the interendothelial slit. Hyposplenism is frequent and has a risk of severe, even life-threatening complication. For sickle cell disease patients by the age of 4, almost all of them lose their spleen function. However, in sickle cell disease infants in whom the spleen is still functional, acute splenic sequestration crisis can be a life-threatening complication. For sickle cell disease patients, there are many different types of irregular RBC shapes other than the normal discoid shape. In splenectomized patients whose spleen had to be surgically removed due to accidents or various diseases, large amount of pocket RBCs can be found. Examine RBCs from adult sickle cell disease patients who have lost their spleen function. Many pocket cells can also be found. Here, we want to accurately identify irregular RBC shapes and pocket RBCs. We have established the RBC image classification framework based on ours and others' previous work. First, we acquire raw RBC images using an optical microscope with high magnification or using an image flow cytometer capable of taking single-cell images. This step requires close collaboration with medical doctors for accessing patient samples. The most important step is to select and optimize the best deep learning architecture best suitable for the RBC images obtained from different sources and/or different diseases. If the results obtained are not good enough, we would have to make further improvements and do the steps again. To summarize, for sickle cell disease patient samples and classification of 8 types of RBC shapes, over 7,000 RBC images were acquired and labeled from 8 sickle cell disease patients. An average of 87.5% accuracy was achieved, reasonably good considering the complexity of the problem. For hyposplenism patient samples and classification of pocked versus unpocked RBCs, over 3,000 RBC images were acquired and labeled from 7 splenectomized patients. An average of 93% accuracy was achieved, good enough to begin testing the method for medical diagnosis. Next steps. We would like to obtain more training data and further improve the deep learning accuracy and overall performance. We have also started to correlate our results with medical diagnosis and look for direct clinical applications. Finally, we'd like to thank Dr. Camille Rousseau, Mr. Jack Cook, Professor George Kanadakis, and Dr. Meng Jiaxu for their collaboration in this project. We are grateful for the funding provided by MIT JClinic. Thank you.